9% increase. A little bit later, it was a 10% increase, eventually became 15. And last week, we ended up receiving almost 25%, about 23% more than what we had gotten the week before. And our projections for next week are about the same, not in terms of an increase, but about the same for next week what we got this week. But it's always possible that you get some last-minute shipments and things that come in. So in general, as we open up more tiers, we know there continues to be tremendous demand on the vaccine system. We ask folks to continue to be patient, but right now we have expanded, as has the entire state of California, for those 50 and older are now eligible, regardless of underlying health conditions, to get vaccinated. And we're looking ahead to the middle of the month, 2 weeks from now, when it will essentially go to everyone. And so we do expect the supply of vaccines to continue to significantly increase. Again, our internal capacity, just to the public network of sites we've built in partnership with our partners, continues to be about 35,000 a day. We have not hit the supply to get us to that point. We also have plans in place where we could surge to do 50,000 a day at our network of vaccination sites. And again, that is additive to what the healthcare systems and the VA and other folks are doing on their own. But continued progress around efforts surrounding vaccines. We do also see continued progress on efforts around moving into the orange tier. We did now have 2 consecutive weeks at what will be in the orange tier when the state hits that 4 million mark for vaccines in the top HPI quartile. We are not there yet, but at the point that we arrive there, then as a region, we should be prepared to move and descend into that orange tier. We don't know how long it will take. Obviously, you can track the number of vaccines statewide have been done in that. I think we're at about 3.4 million in that top quartile right now. We need to get to 4 million. But once we hit that 4 million, then the tier numbers revise, and San Diego at that point would be eligible to descend into the orange tier. So perhaps as early as next week, but again, we are headed in the right direction. And we're headed in the right direction, again, because our case numbers continue to be very stable. And that is encouraging. We're obviously seeing other states, New Jersey, Connecticut, Illinois, that are facing a different situation. But here in San Diego, we're doing well. I think the vast majority of folks continue to be careful, to be safe, to utilize the face coverings. And because of that, we are not seeing an increase in our cases. And that is what is putting us in a good position to continue to descend with more things coming open. Supervisor Vargas is going to talk a little bit about our health equity program and efforts in a second. We continue to exert tremendous effort and energy to ensure vaccines are available in the communities that are hardest hit. I also wanted to share that for homebound San Diegans, we are expanding the homebound seniors program to homebound San Diegans, regardless of age. They can call 211 to get on a list, and then our aging and independent service folks screen to ensure they truly are homebound. And we have a number of providers that are helping us catch up the backlog of homebound San Diegans, but now it is homebound San Diegans and not just homebound seniors. Before we hear from Supervisor Vargas, let me walk through a couple of our charts real quick, just 3. The first is just the dashboard. Again, you continue to see tremendous efficiency at getting doses administered as quickly as they are arrived, as quickly as we possibly can. Now pushing 1.7 million total doses administered. We're approaching almost 1 million San Diegans that will have received at least their first shot. This represents 35% of those 16 and older who are eligible. And more than 20% of San Diegans are now fully vaccinated, more than 1 in 5. And so again, tremendous thanks and appreciation to all of our healthcare system partners, county staff, everyone who's out there, firefighters, paramedics, everyone who is a part of this incredible vaccination effort, who's helping us move forward. The next one you'll see right here is just our cases. And again, you just see general stability here. Our percentage of positive remaining relatively flat right where we are. Number of cases, they go up and down a little bit each day, but again, generally in that 200 to 300 range, and we think this is a very encouraging sign. I want to reiterate that the goal from the beginning of our COVID response was to slow the spread of cases, to not overwhelm the healthcare system. And so with the presence of the vaccine, it is much easier to do that, and that's why we look forward to continued phased and safe reopening, but continuing to head in a positive direction. And then the last chart here just shows you our somewhat complicated chart here. Most important numbers there are down at the bottom left, the 4.9. Though that is our case rate that came out on Tuesday. Right now it is in red, but again, once we hit that 4 million number statewide of number of vaccines administered in that first HPI quartile, then the numbers change. And the numbers that are now red would be orange. And so as long as we stay at 5.9 or less, once we hit that 4 million mark, then we would be eligible to descend into the orange tier, which would increase some capacities for a lot of entities, gyms, restaurants. More folks would be eligible to go to Petco Park, and we'll continue to work our way out of that. So again, this could happen as early as next week. We don't know exactly when because we don't know the pace or trajectory of statewide vaccines. With that, let me turn it over to Supervisor Vargas for her update, and then we'll take your questions, and Dr. Wooten is here for questions as well. Thank you.
Thank you, Chair Fletcher, and happy opening day. As Chair Fletcher mentioned, for all of us, we've stated that equity in vaccine distribution has remained our highest priority. We have talked about our successes in South County, with now that 99% of seniors 65 and older have received at least one vaccine due to large part the intervention programs we have placed under Project SAVE. I am pleased that these efforts are being replicated in other areas around the county. What I do want to share with you is the next couple of slides. The first slide is a percentage focused on race and ethnicity populations vaccinated countywide. If you take a look at the number, we still, the largest population is still white and Asian. Hispanic and Latinos are still 23%. American Indian or Alaskan Native 22%, and Black or African American 17.7%. What's important here to note, if you look at the vaccines in South County, where we actually have created a lot, next slide please, where we've created a lot of interventions, what you can see is that the numbers are different and they have changed, right? You actually see in South County that there is now a larger population, 34.5% of Latinos have been vaccinated, 32% of Asian, and 18% of Black or African American. This is really due to the intervention programs that we have implemented in the South region over the past few weeks. We can see that they're working, and although there's still a lot of work to be done, what's really great about this is that we're going to be able to expand these efforts across countywide. We've already started in Oceanside and in the central area of our communities. We also know that now the vaccine eligibilities will be expanded to 50 and over on April 15, and then on April 15, it's going to expand to 16 and older. We're going to make sure that everyone gets vaccinated. We have seen that these interventions in places have really worked in the South region. We have also know that it's working in the central area. Yesterday, we were able to open one more vaccination site. The day before yesterday, we opened up a new vaccination site in the Mountain View area, which is also a walk-in site. Yesterday, we explored other equity initiatives like the one that we did with the Sherman Heights Community Center. All of these are trusted locations for many of the surrounding communities, and we're happy to share that our county nurses were out there vaccinating over 300 people in a short amount of time. We're looking forward to coordinating more of these efforts to bring vaccines accessibility to our communities that have been disproportionately impacted. We'll keep you posted on future projects for Project SAVE, as well as we know that 211 is working, and we're going to continue to reduce barriers the best we can. Ahora, me da mucho gusto que estamos aquí ahora, es el primer día de el béisbol, así que todos estamos emocionados, así que hay que recordarles a todos, primeramente, que todavía hay mucho trabajo que hacer. Les pedimos que usen sus cubrebocas. Primeramente, les quiero enseñar una información. La primera es del condado de San Diego, está en inglés, pero también se los quiero comentar porque es importante mencionar que aunque los números en el condado de San Diego siguen siendo en donde 23% de los latinos han sido vacunados, 31% de la comunidad asiática y el 35% de la comunidad anglosajona, si vemos la siguiente información, en el sur del condado de San Diego, puedes ver que hay exactamente 34.5% de las comunidades latinas han sido vacunadas, y también incrementan los números en las comunidades afroamericanas y asiáticas. Esto es importante porque nos damos cuenta que las intervenciones que hemos creado en el condado de San Diego, particularmente en el sur de San Diego, han impactado a las comunidades. Sabemos que las comunidades de 65 años en adelante ya tenemos el 99% de ellos que han recibido por lo menos una vacuna. Entonces, lo que vamos a hacer ahora es seguir creando esas intervenciones por todo el condado. En la ciudad de Oceanside vamos a tener intervenciones. Ayer empezamos en el centro de la ciudad de San Diego, subimos en Mountain View. Ahora creamos un nuevo sitio de vacunación en donde las personas no ocuparán hacer una previa cita. Ayer hicimos un programa en Sherman Heights donde también funcionó. Más de 300 vacunas se dieron a las personas de la comunidad de esos códigos postales. Así que les pedimos por favor que sigan manteniendo los métodos para hacer todo lo posible para que las personas no sean impactadas con COVID. Por último, sé que muchas personas esta Semana Santa la van a celebrar. Ahora que viene el domingo de Pascua, yo sé que lo que queremos estar es con nuestras familias. Les quiero recordar que aunque faltan muchas personas para vacunar, aún no estamos libres de esta pandemia y es importante que cuidemos unos a los otros. Es muy importante que ya vienen estas fiestas, es importante que nosotros sigamos las indicaciones del condado de San Diego, sigan usando sus cubrebocas, sigan practicando el distanciamiento social y eviten por el momento ir o tener muchas reuniones grandes. Se los agradecemos mucho y buena suerte a los padres.
Thank you, Supervisor Vargas. We'll now go to our call-in questions.
Our first call is from Matt Hoffman with KPBS.
Good morning. You guys talked about vaccinating homebound seniors. Earlier, you guys had mentioned it was one of your biggest challenges. Now you guys say that you're expanding that. But just in general, how is progress on that front going and making sure that the most vulnerable are not left behind, especially now that we're, drastically expanding vaccination eligibility here?
Well, it remains slow. I mean, look, it's a challenging situation, Matt, when you have someone who is homebound and you have to take all of the infrastructure associated with administering a vaccine to someone's house and set up, do all the paperwork, administer the vaccine, and then wait the appropriate amount of time, generally longer for these individuals because they are in higher risk. So we're working through it. We've got a number of providers that are helping. We've got some of our firefighter teams are helping. We've got various healthcare systems that are helping. But it is slow. Now, we have moved rapidly to make sure all of the caregivers are vaccinated. And so there should be minimal risk to these individuals who are homebound if their caregivers are vaccinated and they do not leave their house. But we are exerting tremendous effort. But you're not going to see the numbers that you see at a superstation or a pod just because of the logistics involved and how much work goes into it. So we're working really hard. We think it's appropriate. We've had some homebound folks who may not be seniors but are homebound. And so we're doing that. And then we're also ramping up for those that are not homebound but have some type of disability to make sure it is easier and more convenient. Transportation is available to get individuals who may struggle. So we're working hard on it. We know it's important, and we're going to continue to try and increase the numbers.
Gotcha. And I know Supervisor Vargas just said, we're going to get everyone vaccinated. But we know that there is some hesitancy. Obviously, you guys have launched that media campaign with TV ads, digital ads, in terms of targeting people who may be hesitant. Is there any idea if that media campaign is working or if you guys are still finding that there is hesitancy out there?
Well, I don't have any quantitative data because the public opinion poll we did was the end of December, early January. Now, that was very encouraging in that almost 3/4 of San Diegans at that point wanted to get the vaccine. We did see those pockets of hesitancy, and we did launch a media campaign engagement with our partners. And while I don't have any new quantitative data, qualitatively, I can tell you, and the number of folks who have been engaged who have said, I was a little concerned. It seemed like it was too soon. It was too fast. But now that we're now all the way through March, we've got many, many, many months of people getting the vaccine. So for folks whose primary concern was, at the end of December, well, we think the vaccine is too soon, now we're in a very different position. And I think a lot of those concerns have really been addressed. And so we'll continue our engagement effort. We'll continue pushing. And, a lot of the individual efforts, programs we do, again, with trusted messengers in communities is helpful. And then there's just the reality that when a member of a community gets vaccinated and it goes okay, they tell other folks in their community and other family members, hey, this is good, and I feel good, and I feel safe, and I had a good experience. And so we think all of those efforts, the paid campaign, the engagement with community groups, the trusted messengers, along with just as people get vaccinated, they share that word, are going to get us in a really good position to see widespread utilization of the vaccine.
And then just one quick one on supply. I know the governor, when he made this announcement in terms of expanding the eligibility, he said that he was assured by drug makers that supplies were going to drastically increase. At the county level, are you guys seeing that increase, whether it be this week or in the following weeks?
Well, this week is about 25% higher than last week. So, you know, I wish it was 50% higher, but 25% higher is much better. That's the biggest jump we've seen. You know, what we're projecting for next week initially may be about the same as what we got this week. But it is also possible that vaccines, you know, kind of come in a little bit later. So we are encouraged, and we think we are headed in the right direction. If you remember at the beginning, you know, we had big amounts and then we had significant shortages. And so we had tremendous instability week to week in what we're getting. That seems to have stabilized, and we're generally headed in a flat or upward trajectory. And so I think that is encouraging. It's still not enough to meet the demand. You have a lot of folks, especially opening an additional tier today, a lot of folks eligible, and there just won't be enough appointments to meet the need. But we think that the supply chain is headed in the right direction, and we're grateful it's at least stabilized in an upward trajectory.
Thank you for your time.
Thanks, Matt.
This next call is from Ali Rafa with KNSD.
Hi there. Well, Governor Newsom was vaccinated this morning. He received the Johnson & Johnson vaccine, despite the company saying that a batch had been pulled from distribution. Is there any sort of breakdown you can provide as to what types of vaccines will be distributed in what areas, or any sort of breakdown as, you know, what company will be used the most as opposed to another?
Let me ask Dr. Wooten if she has any insight in terms of the breakdown of vaccines in terms of where they go. My general sense, and I'll let Dr. Wooten address this, is, you know, we distribute Pfizer and Moderna, again, system-wide, trying to put, obviously the second dose goes back to the place where the first dose for that same vaccine. In J&J, we obviously prioritize that for those hardest to reach communities, our homebound San Diegans, our unsheltered individuals, our mobile teams, our teams that are out in the field doing farm workers, are harder to reach communities. And then I believe the J&J beyond that population is just distributed throughout the broader system. But let me give Dr. Wooten a chance to weigh in on that.
Thank you for that question. Chair Fletcher basically explained it accurately. We are, as new vaccines come on board, we are distributing them in the same manner across the board. But with this particular vaccine, because it is just a one shot, we are identifying locations or populations that could benefit. Like a homeless population, we're trying to go back to them a second time might be difficult, or older individuals, and also in some of our locations where we're going into the rural area to vaccinate our farm workers. But so far, we are distributing them across all of the various settings that we distributed Pfizer and Moderna. So that's what we're doing and will continue to do as we get more vaccines. Thank you.
Next question.
This question is from Alexis Rivas with NBC7.
Hey, so I kind of have, I guess, a opening day related sort of spring break, Easter weekend kind of question. There's a lot going on. You know, I live downtown. I'm already hearing there was a party bus that went by when I was walking my dog. You know, people are out. They're enjoying it. You saw any of our footage of the beaches. People are out on the beach. We know more people are going through the airport than have throughout the entire pandemic. So I'm curious to know if there's any concern. I know the case numbers are really stable right now, but more than half the country is seeing case numbers in the wrong direction. So is there any sort of, you know, concern that this might, people might be loosening up a little bit too much?
Well, I think there's always a concern. I think that's natural, and it's been a long year, and we've seen this, cases go up and cases go down, and in large part, driven, some by the nature of COVID and perhaps some seasonality, but certainly some driven by individuals' decisions. We just encourage people to continue to be safe. We are moving in the right direction, and we are opening up more things, which means more people are naturally going to congregate. You're going to open more schools, more kids are going to be together at schools. You're going to open indoor dining, more people are going to be together at indoor dining. You're going to open some of these outdoor venues and opportunities, and there's going to be more people gathering. And so I think it's certainly possible that we could see an uptick in the number of cases. We have remained relatively stable while other parts of the country have seen increases, and I think a part of that is just due to San Diegans have been very cautious throughout this and very aware of the nature of COVID and how it spread, certainly a large number of San Diegans. And I think we continue to do that. We continue to utilize face coverings, and we continue to do a phased, very responsible reopening. But you're right. You've got spring break. We're heading into Easter, a time when a lot of families congregate together and gather. And so we continue again to urge people, please be cautious. There is some protection afforded by the number of folks who have gotten the vaccine, but again, not everyone has. And so there is still, a danger and risk out there. But I want to reiterate the point I made briefly earlier, is that the intent behind all of the efforts we've done around COVID has been to not overwhelm the hospital systems, not overwhelm the healthcare system. So it was never to stop the spread of COVID completely. It was to control or slow the spread of COVID so that we wouldn't overwhelm the healthcare systems. Well, now that we have vaccinated the vast majority of seniors and we're vaccinating those with underlying health conditions, there is a less risk to our healthcare system, which means even if we saw some modest uptick in cases, it might not be the same cause for alarm that it had been prior to us having the vaccine and the ability to vaccinate those who are most vulnerable. So we'll continue to monitor it and continue to watch, but I think in general in San Diego, we're doing well, we're headed in the right direction. We just really encourage people, please continue to avoid those very high-risk settings. Please continue to utilize the face covering, and let's really see this through in a good way.
If I could just follow up on, I think you mentioned the numbers at the top. I just want to make sure I got them right. What is our capacity in terms of how many doses we can administer a day versus the actual supply we have? And then what is that going to look like in 2 weeks when it opens up to everybody? I think you said, I don't even want to be.
So I don't know what the supply will look like when we open up to everyone. We don't know that. We know presently we could do roughly 35,000 shots a day, and this is just at the network of county-administered sites we have in partners. These are all the sites you see on the website, the superstations and the pods. We think that we could surge that from 35,000 a day to 50,000 a day. Presently, we're probably doing around 12,500 a day, 12,500 a day at that network of sites. So what that tells you is we could essentially have a tripling of supply and still be able to meet that at our existing network of sites. And if we hit that point where we were doing 35,000 a day, we believe we could surge that existing system to 50,000 a day without having to bring in other sites. And if the supply was there and the demand was there, then we could expand to other sites. So we feel confident that we can handle the increase in supply out of the network that we built early. And we built that network intentionally and early to be ready and prepared as vaccines increased. We would be able to just put them into the system and rapidly administer them.
Thank you.
Good. Thank you. Next question.
This question is from Lindsay Pena with 10 News.
Hi there. Wondering if anybody can tell us if the positive cases amongst the migrant girls staying at the convention center right now will be counted or included in our daily count
They do not count into our local case count because they're not San Diego County residents.
Okay. Thank you.
This call is from Allison Ash with NBC7. Okay.
We lose Allison. Allison, if you call back real quick.
She's there.
You're there?
Not sure if...
You might be muted.
We'll come back.
We'll come back to you.
Paul Sisson with the San Diego Union Tribune.
Hi, thanks for taking our calls today. I wanted to first wish Dr. Wooten congratulations on getting her vaccine. Cool to watch that video. I had a question in terms of the vaccine administration pace. Looking at your vaccine dashboard here, it says you have 145,244 vaccines to be administered. I think it was just said that about 12,500 doses are being administered per day, but you're capable of doing 35,000. So if you've got over 100,000 doses in coolers and freezers, why aren't you doing more than 12,000 a day?
I'm not tracking what you're. No, to be administered, Paul, is scheduled.
I see.
On
So
the
those
dashboard,
are ones that are just kind of, you can get an appointment.
Those are not vaccines we're sitting on. Those are scheduled appointments. I mean,
Okay.
for the next
So that's
7
not
days. So that is projecting out for the next 7 days what we know we already have scheduled, primarily second dose appointments. But those are not vaccines we're waiting to administer. Those are just scheduled appointments. We're waiting for the arrival of more vaccines to fulfill those to be administered.
I see. Okay, thank you.
Uh-huh.
And then regarding folks 50 and older being able to be vaccinated starting today, are you guys seeing any kind of logjam on MyTurn and other scheduling apps that might be used? What's it look like out there in terms of people flooding in? How can you measure that?
Well, it's difficult to measure. I think the easiest thing, Paul, is just the speed at which open appointments are taken. And early, if you remember early when we were doing this, when we first opened to seniors 75 and older, they were all immediately gone. And then there was some slack in the system that allowed us to open up to the next tier. We haven't seen any slack in the system for a considerable amount of time. We had a little bit of slack right before we did that first group of essential workers. And once we opened up that group, emergency responders, teachers, food, and agriculture, we haven't seen any noticeable slack from then until today. But we have opened up, obviously, additional tiers of underlying health conditions, and now with seniors. And so, there still continues to be much greater demand than there is supply and availability. And we ask for folks' patience, as we work through this, and folks struggle to get appointments. Again, we're doing everything we can to build out a robust network. We're doing everything we can to rapidly, when vaccines arrive, get that into the system so that folks can do that. And then we've got a multitude of targeted programs designed to help those that are hardest to reach. But we still don't have the supply to meet the demand, and so we ask folks to continue to be patient. We are encouraged at the direction we're headed, and I think given the state is comfortable opening today to 50 and older and comfortable saying 2 weeks from now we go to everyone, they must have a high degree of confidence that the supply is going to significantly increase in the next 2 weeks, and so I'm hopeful that they're right.
So I guess maybe a little smarter question might be, today, how many doses, how many new appointments are you able to offer? How many seconds? How many firsts? Does anybody have that kind of?
I don't have it off the top of my head, but we could probably get that, Paul. Like we could walk you through second dose, and then what is left is made available for first dose. So I bet we can track that down and get it to you.
Thank you.
Uh-huh. Next question. That's it. All right, Allison didn't come back. All right, we'll go to our text question.
The first text question is from John Horn from Channel 10 ABC. We are hearing that the Twitter COVID vaccine appointment bots are no longer working because of a technology change in the system. These have helped people who are less tech savvy get appointments. Is the county aware of this, and are there any plans to address the issue?
John, I was not aware of that. I'm happy to, we were happy to look into it. One of the challenges we may face is I think a variety of those bots utilize the MyTurn system to scan for sites. So if there was a change in the MyTurn system in terms of their ability to look into that, we could ask for changes, but again, that's a state-run and administered system. I think those bots have been incredibly creative and a wonderful resource. You got to be a little tech savvy to be on Twitter, but I think it's been a tremendous asset and resource to a lot of folks and very valuable. So happy to look into it. But again, if the technology change was at MyTurn at the state level, we would have no ability to directly change it. We could request perhaps some changes, but we'll have to look into it and see if we can get more info.
This next text question is from Matt Hoffman with KPBS. He wants to know, per an announcement from the governor, are San Diegans allowed to bring family members to vaccination sites to get a shot?
Let me have Dr. Wooten address that one.
So as people heard from the governor last week, that is the message that was disseminated, and we are trying to figure out how we will operationalize that action. So the governor did announce that, and again, we're trying to figure out how to operationalize it.
The next text question is from Claudia Bujio with Univision, and she's asking for a response in Spanish. How is vaccine supply improving? This week there was a 10% increase in supply. What is expected for next week? And I'll read the second question afterwards.
You can go ahead and read the second question.
The second one. How is the county planning to manage the influx of eligible patients with the 50 and older group and the number of available appointments?
Sí, la pregunta es específicamente que estamos viendo, hubo un incremento de 10% de vacunas la última semana y ahora, ¿qué vamos a hacer ahora pues en realidad que ahora que vamos a poder tener personas de 50 años a más y cómo le vamos a hacer, ¿no? Entonces, como decía Chair Fletcher antes, estamos confiados que el Estado fue el que decide las diferentes fases que empiezan a abrirse en cuanto a quién tiene acceso a las vacunas. Hoy empieza 50 en adelante, entonces lo que vamos a hacer y lo que hemos visto es pues que las vacunas están yendo bastante rápido. Lo que estamos esperando es que va a llegar una nueva cantidad de vacunas que van a tener acceso para las personas en nuestras comunidades. El problema después de que lleguen las vacunas a tiempo, sí hemos visto una incrementación en cuanto a las vacunas, pero pues pedimos paciencia en las comunidades porque de todos modos ahorita, como sabemos, hay muchas personas que quieren tener citas y no han podido tomarlas porque pues no hay suficientes, pero nos han asegurado que vienen las vacunas ya de por medio y lo que tenemos nosotros es una infraestructura para que cuando lleguen las vacunas ya estemos listos para aportarlas. Lo último que quiero decir es que espero que tengan una feliz Pascua también. Gracias.
All right, that concludes our questions for today. We thank everyone for joining us. We'll be back with you next week, and go Padres.